Hello, everyone. My name is Abdulrahman Abduljabbar. I'm a general physician from the Kingdom of Bahrain. And today I'll talk to you about research that we did, which is about the prevalence of low back pain among nurses working in secondary and tertiary healthcare in the Kingdom of Bahrain. First of all, I would like to thank the organizing committee for having me. And let's start with a quick background regarding the topic. Occupational-related illnesses and injuries have high rates in healthcare settings, which can include multiple types of injuries or illnesses, basically like infections, needle stick injuries, or even low back pain. But low back pain in particular is considered to be the second most prevalent type of pain in the general population and one of the leading musculoskeletal disorders. So what's the definition of low back pain? Well, according to the National Institute of Occupational Safety and Health, low back pain is defined as both acute or chronic pain at the lumbosacral, buttock, or upper leg region. But regarding the prevalence of low back pain, worldwide there was a study conducted and showed that the prevalence is increasing throughout the years and reached from 40 up to 90% worldwide. But in countries like England, Australia, France, and the US, multiple studies were also conducted within 1 year periods and revealed that the prevalence is between 29 up to 59%. Fewer studies were conducted in the Gulf region, which is where Bahrain is located. One of them was done in Saudi Arabia and showed that low back pain among nurses ranged between 48 up to 85%. In any hospital, the nurses represent approximately 1/3 of the working force. So if they develop low back pain, it can have substantial impact on the quality of health in this hospital or institute and can cause multiple work restrictions for the nurses and also can cause them to abstain from work or have sick leaves. So because of the importance of this topic and because it's not well studied in our country, we had this research question in mind, which is what's the prevalence of low back pain among nurses working in secondary and tertiary healthcare. The aim of the study was to provide baseline data regarding the prevalence of low back pain to the authorities and hope that we work together on preventive measures. The objectives were divided into two main objectives. The first one is to estimate the prevalence of low back pain, and the second one is to identify the different risk factors or factors related to low back pain in nurses. For the methodology of the research, the study design is a cross-sectional study. The source of the data were the nurses themselves. The sampling technique was a bit difficult, but we divided the different departments into stratas, and we had a proportion from each department, which is a constant percentage, which is 15% from each department. And the sampling technique itself was convenient, which means that we collected data from any volunteered nurses at the time of data collection. The total study population were around 1,432 nurses working at the time of data collection. And the sample size itself was 15% from that, which means 215 nurses. The inclusion and exclusion criteria, we only took female nurses for the sample. We excluded males because we can't guarantee that we will have males in each department. So that will mess up the proportional technique. We only took or included full-time nurses working 36 hours or more per week and working for the past 2 consecutive years. We excluded males, as I said. Also, we excluded long-term absenteeism, which means that the nurses took long periods of days off, which was 3 months consecutively. If it was birth leave, or even if it was childbirth leaves, or if it was unpaid leave or study leave or a gap year or whatever it was excluded from the sample. We also excluded nurses who had current pregnancies in the past 12 months or are currently pregnant, because pregnancy can cause low back pain as a side effect. For the study instrument, we had a modified questionnaire that was constructed based on the previously published papers and certified questionnaires regarding low back pain. And the previously published papers, we took the multiple risk factors that they studied, the significant and also the non-significant risk factors, and we included them in our study in hopes that we can identify the significant risk factors in our population. We did pilot studies for the questionnaire. We did them twice. We had some minor feedback regarding the questionnaire. Some questions needed to be edited, and they were edited. The questionnaire was self-administered by the nurses themselves. It was divided into 4 main categories. The first one was cognition and consent, which is basically that we told the nurses what we are going to do with the research, what was the aim of the research and what we are looking for. We gave them a written consent that they can read, and if they agree to the consent, they can tell us verbally, or if they continue to do the questionnaire itself. The second category was sample characteristics, which means the nationalities, the department that they work in, the number of working hours, and so on and so forth. The third category was social and medical histories, past and current, if they currently have any medical illnesses, if they had any medical illnesses or traumas in the past, if they have family history of any diseases that can cause low back pain, and other diseases like diabetes and hypertension and others. The final category was low back pain related questions, which was the bulk of the questionnaire. It had multiple risk factors that we had and that we read about in published papers. And we asked the nurses about each one of them. Then we go to the ethical considerations. We obtained approval from multiple ethical committees. The first one was in the Research and Ethics Committee in the Arabian Gulf University. The second one was the Ethical Committee of the Ministry of Health in Bahrain. Also, we obtained approval from the supervising nurse in each department and the supervising nurse on shift each time we collected data. Verbal consent was taken from all participants, as I said, and the participants were provided the comfort and privacy needed for the questionnaire. And we also informed them that we will not keep any data about them or their names or anything, so it was completely private. So we go to the results of the research. The main result that we had is the prevalence of low back pain. From the 215 nurses that we had in the sample, 158 nurses, which is almost 73.5 nurses, reported that they had low back pain, which was significant. It was not significant as it has a p-value of anything, but it was significant because it was high. It was higher than multiple countries, but also it was within the range. Personally, we thought it's going to be much lower than this. So it was 73.5% of the nurses had low back pain, and 26.5% reported that they did not have any low back pain. Then we go to the general factors that can cause low back pain. We divided the factors into 2, general and occupational. For the general factors, we had many factors, but the significant ones were 3: age, nationality, and history of musculoskeletal or rheumatological diseases. We found that age was significant, as nurses who are younger than 30 years old had higher chance of having low back pain with a p-value of less than 0.001. 92% actually of nurses ranging ranging lower than 30 years old had low back pain. Nationality of the nurses, we found that Bahraini nurses had higher prevalence of low back pain with 92.5%, with a p-value of lower than 0.001. History of musculoskeletal rheumatological diseases. If they had history, they had low back pain. 90.6% had low back pain, which means that the p-value was 0.017. We had other risk factors, but they were insignificant, like body mass index, marital status, number of children, smoking habits, and others. For occupational factors, we had also 3 significant factors that we had. The first one was lifting objects, lifting heavy objects, and carrying patients and moving patients. It was significant with a p-value of 0.006. 81.4% of those who lifted the objects had low back pain. Those who walk for long distances also had significant p-value of 0.049, and 79.4% of those who walked for long distances had low back pain. And running for long distances also was significant with a p-value of 0.011, and 95.7% of those who walked for long distances had low back pain. Other insignificant factors were working department of that they work in. So there was no actual significance between different departments. The length of the career and also night shifts. The length of career was shocking, to be honest, because we had multiple research that we read about that younger nurses or new nurses had higher levels of low back pain, and other researchers that said that older nurses or those who have been working for 10 or 20 years had higher levels of low back pain, but it was insignificant in our research. Also, we focused on the number of days that they suffered from low back pain, and 17% of those who said that they suffered from low back pain stated that they had low back pain every day for the past year, and 22% said that they had low back pain for more than 30 days, but not every day in the past year. 24% said that they had back pain from 7 to 30 days in the past year, and 37% said that they had low back pain for less than 7 days. Now we go to the burden of low back pain, how it affected the nurses. So we had 158 nurses who suffered from low back pain, but 52.5% reported that they experienced movement restriction, as they can't rotate their backs or have, and they had some type of movement restriction. 43.7% of the nurses who suffered from low back pain reported that they visited a therapist for consultation. A therapist ranged from physiotherapist to an orthopedic or rheumatologist, but they sought help, which means that 43.7% of those who had low back pain actually had to seek help, and 39% were absent. They reported that they had days off in the past year because of low back pain, which means that 39%, which is 62 nurses, actually needed to take days off. So the prevalence of low back pain, 73.5. It is highly prevalent, but still comparable to other studies. But it differs from the majority of studies. The majority of studies had lower prevalence of low back pain. And for the risk factors, as I said, we divided them into two. Multiple of them were significant, but this can be attributed to the difference in prevalence, and the risk factors can be attributed to the cultural background, the genetic factors, and the nurses themselves. They can have the knowledge and attitude to do and stand the right way and move the proper way to decrease the prevalence of low back pain. But this needs to be focused on the future. As a result, that caused the difference between us and other countries, I think. And then we go to the burden of low back pain. As I just stated, we had high number of absenteeism and need to seek help due to low back pain. And also the movement constriction can cause decrease in productivity at work, which means that this low back pain, which is something that nobody focuses on really, had significance in the population, and also has a huge burden on the population. So our hope from this study is that they take the authorities take it as a serious matter, that they shed more light on the topic and the risk factors, and they try together to find some ways to decrease the prevalence. Our recommendations were given to both the university and authorities in Bahrain, and some of them were about raising awareness about low back pain, having routine checkups, and also providing suitable equipment. And some of them were taken into perspective, and some of them were done. In new hospitals in Bahrain, they have provided suitable equipment and also machines that can carry patients, rotate patients, and help the nurses in their job. So that's it, and I hope that you all enjoyed this topic and this research and presentation, and feel free to ask me any questions that you might have. Thank you so much for having me.